Good evening. This is Dr. Diamond. I'm glad that you were all able to join us this evening for this really special event. I promise to get everyone done and ready for the Eagles game. No worries or fear. We're going to be discussing some really unique and special procedures. I've been involved with surgery and urology for over 30 years, and this has been a journey to develop what we call the Diamond XL 360 procedure, which I hope you'll all enjoy this evening learning more about. At the end, of course, there'll be time for some questions. You can type them in. And of course, at the end, you'll see information to get in contact with me personally to discuss more of these things. But let's get right into it, shall we? And again, thank you for taking time out from everyone's busy workday and before the Eagles game to share this special night with us. So a little bit about me just to get us started. I'm from New York originally, although I am an Eagle fan, so don't get excited, everyone. I was trained in New York, and I did a fellowship at Memorial Sloan Kettering in cancer, and uh, came down to South Jersey in 1998. I was in faculty at Cooper and Thomas Jefferson for 8 years before I went into private practice. During that time, I spent a lot of time doing minimally invasive work. So I've always been involved in kind of cutting edge care. I started doing laparoscopic procedures before anyone was really doing laparoscopic procedures, making small incisions to remove small parts of kidneys and bladders, to achieve excellent cancer control, but have patients have a minimal response in terms of the pain and discomfort. So really trying to do cutting edge urologic work. I left Jefferson and returned to Cooper, which had the first Da Vinci robot in the Delaware Valley, and was the director of robotic surgery there for about 4 or 5 years, and then decided to go into a more of a community practice, trying to bring my academic procedures to the community. And I've been doing that for over 20 years. So you might ask, well, how did this all begin? Why am I doing penile enlargements? Why am I doing all these unique procedures? So my wife, Noelle, as you can see here, yes, obviously I've upgraded quite a bit in my life. Having my wife, we actually met at a small hospital, community hospital in South Jersey, where she was the head of dietetics. But my wife, Noelle, and I've been married for 15 years, and we have two beautiful daughters, Victoria and Juliet. I do have three other kids, Josh, Ethan, and Chloe from a previous marriage. But her and I had been talking about doing something together in the aesthetic field for a long time. Obviously, Noelle is well attuned to the aesthetic world. And approximately 2 years ago, we started thinking about doing something. Now, where does our name NDA come from? So obviously, Noelle Diamond is the major portion of our name, Noelle Diamond Aesthetics. But NDA also has a real important meaning to us because patients are coming to us with all kinds of sensitive issues. It could be a scar on the face. It could be weight issues. It could be erectile dysfunction, sexual dysfunction. So NDA, or non-disclosure agreement, also means your privacy is your privacy. We take that to heart. Whether someone's coming for wrinkles or skin damage or a penile enlargement, we take what we do very seriously. We take what we do to heart, and your privacy is important to us. So that's another reason why we coined the name NDA, which has been trademarked, and we're very proud of that. Um, just before we get into really why everyone has joined us, I just want to go over some of the other services that we offer and point out some important ones that I think are men focused. Listen, as we get older, men gain weight, men have skin damage, men lose their hair, men have low testosterone, men have sexual dysfunction. So we're a full service medical spa. Uh, and Noelle is the medical director. Excuse me, I'm the medical director, although she likes to think she is as well. But she's the aesthetic director, really the brains and the beauty behind the practice. So we have, some of the traditional things that you'll see, laser hair removal. We do all kinds of special skin treatments, minimally invasive, that don't require any downtime for sun damage and skin damage, fine lines, wrinkles, reds, rosacea, all these kinds of things. are done in a minimally invasive fashion. We all know that everyone has a busy schedule. Everyone doesn't have the ability to take off a lot of time to recover. And a lot of us, when we started doing Zooms during COVID, started realizing when they were looking at themselves, as I am now, that wow, I've really gotten older. My skin doesn't look good. So that is another drive where a lot of people started doing a little self-reflection and self-growth and really trying to take care of themselves, both internally and externally. A lot of things that we do at the spa we call regenerative care, whether it's working on your skin to regenerate the basic layers of the dermis, whether it's regenerating the structures within the penis using something called P-shot, which we'll get into in just a couple minutes, Botox. But that's one of our major goals is really kind of regenerating the body. We do plasma-rich protein, which we're going to talk about in a few minutes for the penis, but we can do that for your hair. I've done that myself to help stimulate hair growth. We do have EON, which is a non-touch robotic laser that when using that, you'll get a 24% reduction in the area that we're treating. We remain the only facility or medical spa in the Delaware Valley that has that. It's an amazing procedure. We do all kinds of wellness IV infusions. We are really big about peptides. So we're a full service medical spa along with the unique special things that I do. And when we came up with the idea of doing the medical spa, Noelle and I, one of my urology rooms, we converted it into a kind of demo room where we tried all the technologies that we were thinking of getting on each other, on friends and family. Who else better to try that on, really? Because I feel strongly if you're going to do something to someone else, you should really have that experience yourself before you do it. This way you can really relate to the client, what it's going to be like, what the recovery is going to be like, what your expectations are, the realistic expectations you should expect, because we really put our heart and soul into this. We live in the town of Moorestown, and our spa is in the same exact town where we live. So we take pride in everything we do because we do see clients out in the community, and we really want them to be proud of the work that we do, and we're very proud of what we do. But with that said, I wanted to figure out what can I do and bring unique, being a urologist dealing with men and sexual wellness, testosterone issues over the last 30 years. And that's kind of how the Diamond XL 360 came to be, because throughout my career, you can imagine I've taken care of, by this point, hundreds of thousands of men and women with sexual dysfunction. And a lot of men throughout my career, besides talking about performance issues, were asking me about size. And for 30 years, I would say, well, your size is your size, and there's nothing I can do about that. And that's kind of what I've been focusing on the last several years, trying to think of ways that that doesn't have to be. That why should a man who's unhappy with his size or girth, the way it appears, the way they feel they can't satisfy their lover, why should they not be able to be given the same kind of resources that a woman who wants larger breasts? I mean, there's women get larger breasts and we don't think twice about it, or they want a bigger butt, but men have up to now really not had that option. And why should we not? So I started thinking a lot about that and ways we can do it. And as I got more comfortable using fillers in the face and other Botox in the face, I started thinking about a way we could do that. And I think we've been able to successfully achieve that. And I hope to share that with you in just a few minutes. One other unique thing I wanted to share that we have is called the Visia. This is a 3D computer system that is complementary to all our patients, men and women. You put this your head in this little device, and then you're going to really get a 3D measurement of your skin damage, reds, sun damage, and you're really able to track the patient's needs. It's not just a physician looking at you and saying, "Hey, I think you need this. I think you need, this treatment." You're able to take this computer generated data, which is we're all going towards AI. Why would we not be doing that in a medical spa? And really assess the skin with the computer. It goes below the surfaces of the dermis, and it gives us a real treatment plan for you with the computer helping us along the way, guides you to what you're going to be needing. You also, when you do the computer program, you can look at the treatments that we're offering, and the computer will generate what the results will look like, which is pretty amazing. What you'll look like if you don't do anything, which is pretty scary. And then lastly, we use this to track your progress, meaning from day one, we do this, we keep this in your file, and then we move on to your progress through your treatment program. So again, another unique thing for everyone that we offer complimentary because we're all about trying to better our abilities to treat our patients, but also the patients learning about these technologies because a lot of people come to us for all various reasons and they don't know what they need and we're hoping to guide them along the path that works them. It's a journey. I often say dip your toe in the water. You don't have to be overwhelmed by everything we're talking about. We're going to help you along the path. So let's talk about what we're really going to focus on today. We're focusing really on men's health in this unique special space that we've created. A lot of the things we're talking about also can be translated to women. So any of your partners or anyone that you know out there that thinks they have some related underlying sexual dysfunction, we can talk about that as well. Let's talk about the full complement of what we offer because it's not just about penile enlargement or about Botox or about Scrotox. It's about the whole package and what we can do to help you. So obviously testosterone is a really big topic, both for men and women. I've been taking care of men for, 30 years for this. In the medical world, I'm limited to your lab work and then gels, which, some of you have been using, you rub on your shoulder. There's needles. There's a whole bunch of treatments available. They're not particularly great. I'm limited to what I can do because the insurance carriers will only allow us to raise your levels a certain amount. I'm really not a big fan of the injections because you get peaks and valleys. You're up one day, down, and a lot of issues related to that, which I don't like. A lot of men have been going online, which I really encourage you not to do that. These medications are fantastic, but they are medications and they have to be watched closely. You have to keep an eye on your total blood count. You have to keep an eye on your testosterone, of course, and for men, the PSA. So we use something bioidentical hormone therapy. It is a little tablet, which is made from, excuse me, I'm just going to show us a little video. Sorry about that. This is a little bit about the tablet. We are basically, it's the size of a Tic Tac. We inject it into the butt. It is a slow, continuous release of testosterone. We do this for men and women. For women, we also give them progesterone, sometimes estrogen. In the spa, we're going to get you up to about 1400. The range of testosterone is anywhere from about 250 to about 900. In my regular insurance-based world, if I get you to 500, I can't get you any higher. Your insurance won't let me. But here we do what's called hormone optimization. That's going to give you energy, focus, attention, libido, sexual desire, drive, and performance for both men and women. It is really amazing. I do it myself. I'm a client, not just a med spa owner. As you can see, it's a simple procedure to do. Great. And again, medical managed. We're caregivers. We're going to be drawing your labs before we do this. A month later, we're going to draw your labs. It's made from both sweet potatoes and soy, so it's natural. We also give you some herbal medications to lower your estradiol levels, which sometimes can be elevated with these types of therapy. So again, part of the package that we're looking at to help our patients. Some other unique things we do, we'll talk about P-shot for a little bit. P-shot and the way that is performed is it's used to increase sexual pleasure, increase sometimes size of the penis, a little bit of girth improvement, but it's really used mostly for men who are having some sexual dysfunction. The way we are doing it is we're going to draw your blood in the spot. We're going to spin it down, and we're going to get this really special stuff when after you spin your own blood down called PRP or plasma-rich protein. That has growth factors and stem cells, and P-shot or PRP is being used all over the body. You may hear some people getting in their shoulders. It helps to regenerate tissue in their joints, and it can be very helpful. So after you spin it down, I do a little bit of a block to the penis, and we're going to inject it in 4 spots in your penis, which we'll talk about in a few minutes. The anatomy of the penis are 2 structures called the corpora cavernosum, which fill with blood. And we do 2 shots, one on each side of the base, one on each side towards the mid, and then a little bit in the head of the penis. That can also help with premature ejaculation. But this treatment can really help regenerate the delicate parts of the corpora cavernosum, which is what fills with blood and dilates and causes an erection. I like this for patients who have some mild sexual dysfunction. I like it for patients that want a little bit more, maybe a little bit more oomph when they're sexually active. Simple, easy. It's your own blood you're getting back. It's no other person's blood. It lasts about 18 to 24 months. It's a really great procedure. I really encourage a lot of our patients to use it, and it is fantastic. We also do the P shot, excuse me. We also can do what's called the O shot for women, where we take the same amount of this plasma-rich protein, and this time in a woman, we're going to inject the anterior vaginal wall back to the G spot. And then we're also going to inject the clitoris. The clitoris in a woman is made up of the same nerve endings as the glands of the head of the penis. So that increases pleasure, sensation, moisture, lubrication. So again, I like to call that the O shot or the orgasmic shot, another really great product for women. And a lot of women issues in terms of uh, cancer, ovarian cancer, breast cancer have been really on the forefront, but a lot of women who have come to me over the years for sexual dysfunction have not had a lot of good treatment options, nor have they been really looked at in terms of testosterone. And we're really cutting edge in terms of this regenerative technology we're using to improve their sexual function and pleasure as well, not just men's as well. So it is available for both patients. We also can use Botox, and Botox for many people is a neurotoxin. It comes Dysport, Xeomin, Botox. Botox is the most commonly one used name. It relaxes the muscles, and people really are familiar with it, for example, in wrinkles. And how it works in wrinkles is you inject below the skin surface where the muscles are, contributing, contracting the skin. It relaxes the muscle, and that's how the wrinkles kind of settle down. We use that in many different reasons. People use it for migraines, TMJ. We use it in urology in the bladder. So you can take Botox and you can inject it into the penis in the same corporal structures I just mentioned ago that fill with blood. And the Botox relaxes the smooth muscle in the corporal bodies, and it's been shown to increase sexual function. So, for example, there was a good study where they found that patients that were taking Viagra, Cialis, or oral medications who no longer were effective, by adding the Botox into the penis, over 75%, those medications started functioning well. On top of that, and that's a great procedure, I also really like P-shot and the Botox together because they work much differently and they're really, really, really good to be very effective on top of that. The other thing I really like together is I like to use a Botox in the scrotum. So some people, the scrotum becomes very tight over time. And what you can basically do, as we mentioned a second ago, the Botox or these neurotoxins work to relax the muscles. We inject it in the scrotum area, and that can relax the scrotum, give it a more fuller look and more comfortable look, which a lot of people find very aesthetically pleasing. And you also can take filler and also inject filler into the scrotum as well and give it a fuller look. So the Botox by itself is great for sexual dysfunction. The Botox and P-shot together is really, really, I think, a home run for this type of issue. And the Scrotox is good for the tightness of the scrotum. You want a fuller scrotum. One thing I wanted to mention is you can also take the Botox and you can inject it into the suspensory ligaments. This is the pubic bone right here, and this is the ligament called the suspensory ligament. You can inject the Botox right into the into the suspensory ligament here, and it will relax the ligament and give it a little bit more of a length. In the old days, people used to cut the suspensory ligaments here, which is an invasive procedure, and it really just made the penis seem a little bit longer, but didn't give it any width or girth. So you can, in a much easier way of doing that or achieving that accomplishment is just injecting some Botox in the suspensory ligament, which we do quite often, which gives us a little bit nice leg. Let's talk a little bit about some penile anatomy here, just so we're on the same page. We're going to talk first. These are the two structures on both the right and left side. These are the corpora cavernosum filled with blood. This is the top of the penis, or this area right here blown up. These are where the arteries and nerves are. So you have to be very careful there. So one of the things we're talking about today is when we're talking about the P shot and the Bocox, we're injecting it into here, the corporal bodies. We're going to be talking finally in just a few minutes about the Diamond XL, the increased girth procedure. And a lot of people out there are not urologists or surgeons doing the procedure. And a lot of people who do it are afraid to inject, which they should be on the top here because of the nerves and arteries. So they just inject the side area, which then makes it look very awkward because if you just inject the side, you can imagine the top is void of any filler. It looks very strange and weird. And that's really kind of where I came up with the idea. Being a urologist, I've come up with the technique where I do the 360. I go completely circumferentially around, which you'll see the results in a few minutes, which gives it a very aesthetic, pleasing appeal to both you and your partner. Because if you just do the sides, you might have a partner that looks at you like, hey, your penis is a little bit deformed. What's going on? Ours will never look that way because it's completely 360 and it gives it a very increased girth and size and length because of that technology that we've developed. The last procedure I wanted to touch on before we get to the Diamond XL is we do shockwave therapy as well. In the penis, as we can get older, the neogenesis of the arteries, as you can see in this picture, are not as prominent. In shockwave therapy, we're going to take a little shock device, and a lot of people get that if they've ever had any orthopedic procedures or a chiropractic procedure. It's a little device that kind of almost like a small jackhammer. And we're going to do this along the penis on both sides, like we showed a second ago, on both sides of the penis, here and here. We're going to shock the areas where the arteries and nerves come in for sexual function on both sides, and also below the penis on both sides. This is a therapy that is about 20 minutes per session. We usually recommend doing once a week for about 6 weeks. And basically, the shockwave therapy helps the regeneration of the arteries and the vasculature to the penis. And it's a minimally invasive procedure. When you start combining it with the P shot or the Bocox, it's really, really excellent. I do the shockwave therapy for this reason. You also, for some men that have what's called a Peyronie's plaque, which is a curvature to the penis, you can soften the plaque using the shockwave therapy. But I also really use it a lot on every patient with the Diamond XL because it helps to soften the injection of the filler, which we'll look at in just a second. So another option that we offer, it's about being comprehensive. We're not just doing one thing. We're looking at our patients in entirety, much as we're looking at their skin, we're looking at their sexual function, talking about their hormones. We're talking about their performance issues. Are they taking Cialis? Do they need shock therapy? Do they need various things? So it's about being comprehensive, not offering one thing, but being a complete package to all options that we can offer. Hey, it's Dr. Diamond here, the medical director at NDA Medical Spa. Today we're doing one of our special penile enlargement procedures. We call it the Diamond XL 360. Why do we call it that? Where the arteries, nerves, and veins to the penis lie. So most people who have no experience doing this, particularly not surgeons, avoid that area. So when they do it, they basically fill just these side areas. This area just on the side, and they don't go here. By not going across the midline, you don't get a 360-degree fill. So it looks awkward. The sides look large, but the middle of the penis is devoid of filler. We don't want that. We want our patients to get girth and size 360. That's why we do the 360 procedure here at NDA Medical Spa. So when I mark the penis, as we talked about, we're marking the sides. I'm looking at the different sides I'm going to fill. During the filling procedure, the patient and I will both stand up and lay down and look at the areas that are of concern. I also, in a few minutes, aren't going to just do this by my eye. I'm actually going to take a ruler and precisely measure the areas. I make boxes. So I'm going to take this ruler and I want to make it as symmetric and cosmetically appealing as possible. So I'm just going to measure and then make boxes, which we'll show you in just a second. Because it's a precise procedure. There is artistic ability that when I do this, but I also want to be pretty precise. I want to make sure that each area of the penis is getting the appropriate and ample amount of volume turn incisions. It's aesthetically pleasing, but it also should be really comfortable. There's no reason for any patient not to have comfort during this procedure. So first, I'm going to do just a superficial wheel of a little bit. I was told that we didn't have much volume for a while, guys. I'm sorry. I'm going to cut ahead
The
to
filler that I use also has Lighting XL 360, protecting the penis
cut
without
ahead a little bit too, because you guys saw all this one.
going to use these boxes. Just going to go around, dilute the filler. This is pure filler, undiluted. Because you have saline or salt water will be reabsorbed and it will go down, meaning it will
Sorry for those
shrink. So
technical
it won't
problems,
give the
guys.
true size effect that you're looking for. We're slowly going around into these boxes that we've made to achieve the goals that we're looking to achieve, again, girth, size, and width.
Sorry about that a little bit. All right, let's get back to what we're talking. So I want to, so as I was saying in that video, I used, when the patient comes in, I assess their size, their goals, why they're doing it. People come for all different reasons. They're embarrassed walking around the locker room. They want a little bit more in their bathing suit when they're at the pool. They feel like they're not satisfying their wife. My role is just to help them along the pathway, give them the guidance that they need. There's many different fillers out there, and depending on what we want to do, for example, if I can increase the size of the head of the penis, I use a softer filler, almost like one that you use in your lip. I use different ones to thicken the penis. Most of the fillers I use can last 2.5 years, but I also have some that last over 5 years. The goal of this procedure is not to increase the girth and the length, and then to have it all the way go shrink all the way back down. We touch up as we go along the pathway. During the procedure, as I mentioned a few minutes ago, I'll have them stand up. We have them lay down because the penis can look different, as you can imagine, standing up or laying down. And the goal is to make it look good in all aspects, in all areas. So it is a process that we work through together. Um, the As I mentioned, I use pure filler. I do not dilute it. Uh, and remember, I do the full 360. So the amount of volume you're getting is the amount of volume you're going to keep, and you'll see the result that day. A lot of people dilute the filler, so they look like they're getting more, but with me, I use pure. So if I give you 10 cc's of filler, it's pure filler. It's not diluted at all. I usually recommend at least 10, but up to 20 and sometimes even more, again, depending on the size of the penis and the results. So let's look at some results. This is a patient of mine who came for various issues. He was not happy with the size. So again, he's a little bit larger out of the gate. So this is his before we did anything. This is right after the procedure. He's actually the video of the patient you just saw. This was with 15 cc's of pure hyaluronic acid filler. I have everyone come back a month later. They come back a month later because once I start injecting, you can imagine there's a little bit of swelling here and there, and it can affect my aesthetic result, what I'm seeing. So when he came back a month later, it looked very good to me, but he felt that this area here was a little bit asymmetric to here. So we did 5 more. This is 1 month later. And this is what he looked like the day after, the day we finished the filler. And you can see he very happy, very symmetric. You can see it's 360. It's all the way around. If you only do the sides, this part is devoid and it looks aesthetically unusual, and it doesn't get that increased 360 girth that you really want. And you can also see the real big difference between his length, right? Between the beginning of this day, the first day we treated him, and after an hour later when we finished the treatment. He is going to be coming back, and he's going to get the more permanent filler because he's so happy with his results. So we look forward to seeing him back. This is a patient. This is the same day. And you can do this in uncircumcised patients as well. A little bit different technique I use because you have to be careful the way you do the skin at the end of the penis because it's thinner. And again, this is where it's important to have someone with a lot of experience. So this is a patient, and you can see the before picture, and this is the after picture. This is, I think, a great case. This is a patient of mine who had a radical prostate, who lost a significant amount of length in his penis. This is the same day, obviously. This was before, this is after. You can see the significant increase in length. This is a great picture, I think, because you can see the side profile and you can see the huge difference, not just in the length, but again, it's going to give you that complete 360 degree result that you're looking for that looks much more symmetric, much more natural. No one knows you had anything done. They just see a larger, bigger penis, and you can't tell anything has been done unless you want them to know. Again, a different patient. This is a before and after the same day. And you can also see this line is the same as this line, but you can see the increase in the length from that day. Again, I think this is a great picture because this is before we did anything, and now you can see what I'm talking about. This is that no man's land where most people should not go across, but I, as a urologist for over 30 years of experience, dealing with penile fractures and putting a penile prosthesis in and doing all kinds of penile surgery, I know where the anatomy is. I know how to be safe to preserve the nerves and arteries, and then you get that beautiful 360-degree looking penis that looks very natural. This is a different patient who came back a month later, and now we're doing a touch-up on him. And when I do the touch-ups, we look again, standing up, laying down. We really want to get the vision. And then, like I do the first case where I mark out the whole penis, this one I'm just marking the boxes that him and I see together that bother him. Now, if you come back a month later and you're happy, we don't have to do anything. It's what is bothers you. It's not what I see, it's what you see. And when we're there together, sometimes I'll have the patient's partner come with them as well. So we all three of us look at what's going on to see what we are bothered by. So this patient had this, and you can see here, this little box is a little bit more shallow than this area, and it bothered him. And he had two small areas on the left side that bothered him. So he comes back, we measure everything again. And then this is afterwards. You can see now this is the box before was a little bit more shallow. And this box now is much more symmetric. So you can see this looks a lot more symmetric than it did before. And the sides, those little boxes bothered him. He's not been back. After the 1 month, we wait to hear from you. You want to come back in 6 months for a touch-up. You want to go for the longer acting one, that's going to be up to you. We do have some pre-treatment protocols we like for patients to do for their skin, which are kind of our special secret sauce, so to speak. And we do have some post-care treatments we want to do that we go over to ensure a good result. As I mentioned, one of the things we like to do is after the treatment, the first day, we do take that shockwave therapy and we run it along the penis because we want to make sure the filler gets nice and smooth and nice and symmetric. We don't want anyone to feel a lump or a bump. We're very careful about doing that. We really want no one really to know that you've had anything done, that it should be your own business. If you want to tell someone, you can. This is an interesting patient. This is a young 54-year-old guy who had significant erectile dysfunction. He actually has a penile prosthesis in. And, I've done thousands of penile prosthesis throughout my career. And interestingly enough, it gives him the erection. But what happens is the penis gets very thin. And for years, not developing this procedure, I would say, okay, well, you're having erections. There's not much I can do for that at all. It is what it is. Just like I would say to my patients, your size is your size. Now we don't do that anymore. We can do that. So with this gentleman, I did filler. With him, obviously, you have to be incredibly careful because in the penis, in those two structures called the corpora cavernosum, are two cylinders, and penile prosthesis, the way they work, there's a pump in the scrotum, and you pump it like the old Michael Jordan sneakers, and the fluid goes, saline goes into the cylinders that fill up. So you can imagine when injecting, as you saw in the video with needles, you can easily puncture that. And you have to be incredibly careful not to, even as a urologist, incredibly careful. So I just finished him last week. This is his before picture. This is his after picture, which we're slowly, he's uncircumcised. So this ledge here is the edge of the corona or the head of the penis, but we're starting to fill him. This process is a longer process because I don't have a lot of space between the cylinders of the prosthesis and the skin. So I have to be very careful. So this will take longer than the traditional patient who doesn't have a prosthesis, because now what I'm doing is I'm taking the space between, let's pretend this is the corporal body with the prosthesis and this is the skin. I'm just slowly putting filler in to expand that space more and more and more slowly. I can't do as much as I normally would do because I'm afraid I would puncture the prosthesis and that would make him a very unhappy patient. So again, this is a novel treatment for men who have to have penile prosthesis, who unfortunately are just very thin. we're now going to be able to bulk them up to give them a wider penis to again achieve patient satisfaction, both sexually and personally. Well, I know we covered a lot in a short time, and I apologize for the technical issues. We're getting through these. Um, for all our patients who've been participating with us, we're, as you can see, offering some discounts for some of our procedures that we're doing. And I do appreciate the time and effort that you've taken to come out and watch and observe before the football game. Here is my direct email, which I'm happy to leave up. And the phone number to the office. And I am happy if anyone wants to chat or send me a message, we can do that. If anyone has any questions, they can type me a question if they have anything they want to know. If you'd like to reach me personally, you have my personal contact number. Um, and anyone can go to the chat feature on their computer and chat me. That's a great question. So I was asked the cost of the procedure. So it's variable. It depends on how much filler we are using. And as I mentioned, I normally recommend for someone who's never had this before to start really with the 2.5, roughly 3 year filler, because if you're not happy with something, those I can easily dissolve. It's very similar to the filler in your face. Okay. That's where my idea all began from. If I'm like, we can expand the filler in the face, we can do it in the penis. So, and then there is the longer acting one, which lasts about 5 or so more years. With that one, I don't like to start that for someone who's never done it before because that one is very difficult to dissolve. So if you're not happy, it's very hard to get rid of. I have not had a patient who's done the 2.5 year one who hasn't moved on to the 5 year one, to give you some idea. So in terms of cost, it depends how much filler we're using. I really don't like to use less than 10 uh, per patient because it won't get a great result. So ballpark, for the 10, it's around 6,700. And then for every time we go up, there's obviously discounts. But that's kind of what you're looking at to start at 10. 20 isn't going to be is going to be close to, that number, like, 13 or so. But obviously, there's all kinds of financing available, things like that, if it comes down to it. But we work with you. A lot of times I'll tell my patients to get maybe one or two extra the first meeting. This way they have some extra in case they need to touch up. Um, so again, another question was asking how long does it last? The traditional way of doing it lasts about 2.5 years or so. And again, with that 2.5 years doesn't mean you start after 2.5 years, we go all the way back down to zero. The biggest cost, unfortunately, is the initial one to get things going. And some of the products that we're going to be using will help stimulate collagen. So that also will help naturally keep the penis longer and wider on top of it. But once you start, you don't have to go back down to zero, so to speak, because the body is naturally going to be producing some of its own collagen to keep it going. And then obviously, as you do touch-ups, you're not going to need 10 syringes of touch-up. It might be two or three, it might be four or five. So that's kind of how we look at it. And again, the one I use a little bit, the 5 year one, that also causes a lot of collagen stimulation because that also can help thicken the skin a little bit and also give it a natural response that we're looking for, much like when we do certain types of fillers in our face. It stimulates collagen and helps the body naturally to produce and continue that growth cycle. So again, it all goes back to talking about the regenerative properties that we're doing, whether it's in the hormone replacement, the P shot, the peptides for weight loss. The whole concept that we have at NDA is all about using the body's regenerative technology and procedures and processes. We help it along the way. And that's what we're kind of looking at, and it should be your expectations for how long things will last as well. And again, as we saw earlier, you have my email address. You can always directly email me directly, always available for phone calls. All my patients who come through this process get my cell phone directly. We're exchanging pictures. We're exchanging comments. I'm always available 24 hours a day for any issues or problems. There is really no real downtime. The procedure, as you saw, is done under a block. You can get up and go back to work. There's no real recovery involved. Post-op care, we go over that with you in detail, as well as a pre-op care regimen of skin care, which we like a lot. Um, there's no sexual activity for about 7 to 10 days. That's the only thing we don't want you to do. Other than that, you can pretty much do what you want. If you're on blood thinners, of course, we talk about getting off that. But these are the kind of the standard things that we talk about when we're going forward with any of our patients. Someone, I'm just looking for another question. Someone just asked me. 1 second. So the P shot. Someone asked me a question, what is the cost for the P shot, and are they done in a package of three or whatever with a certain time period between each treatment? So if you're doing the P shot alone, you don't necessarily have to do I'll usually do so the P shot lasts anywhere for about 18 months. So you don't have to do a package of three because you don't need one for about 18 months. So I normally do that kind of alone. If you the Botox or neurotoxins in general across the board last anywhere to 4 to 6 months. So if you're going to do that, again, I don't necessarily recommend that you have to buy a package. When you think you need it again, you'll know, and that's when you come back to see us. The P shot and Botox, like I mentioned earlier, I do like that in combination out of the gate, but in 4 or 6 months, if you feel like you need another injection, I don't necessarily think I would give you a P shot. I might just give you the Botox and see if that works and holds you over to the next time you might need a P shot. So we work with the packages based on the needs of the patient and what I think will be the best result. But you don't have to do a set package, particularly for the P shot and the Botox, because those do have some time period with going ahead. With the Diamond XL, when you come back in a month, we see if you need anything or not, and we discuss that. And if you need a little bit more, we always can add more. You won't usually need a lot. The patient whose video you watch, if you remember from his pictures, he has a larger penis and he had a really nice result and felt that one area. We did end up putting 5 in that area. It looks a little bit smaller on the TV perhaps, but it was a good area to make it more symmetric. Again, when you put packages together, if someone wants, and sometimes I will do this, obviously, someone wants a Diamond XL and they also want a P shot, which you can do it at the same time. They obviously, if you're putting things together like that, we do create packages for obviously discounting some things as well. So that's always flexible. With the spa, there's financing if someone needs financing. We work with what works within your budget. We want to make it the best and most pleasant experience from painless, both the procedural wise and painless in the pocketbook as well. We're here to work together to achieve the goals that we're all looking for, and we want that to be true for you as well. So someone just asked me a question. 1 second. I think it was, I'm sorry, 1 second. So usually, I usually do around 200. You can do 100 units of Botox to get your starting. Again, if we're talking about, so in the scrotum, I usually do about 150 because the scrotum is, you have to do multiple different injections. With the Botox, you're injecting into the penis, and then I do put after I inject the penis. I do put a constriction band down for 20 minutes before I inject it because we don't want the Botox leaving the penis. So I put a band on, and that allows us to make sure the area stays there. So, but normally I use about 200 units of the Botox in the in those areas as well. Any other questions? Well, everyone's got my number. I really appreciate you taking your time out from everyone's busy day and work day to be hearing some of these unique things we're offering. We're excited. we're really excited to kind of tear down the taboos of penile injections and penile lengthening. I don't think this should be a taboo subject as we start with tonight because, women could talk freely about their breasts. If their small breasts bother them, we don't just say, oh, your breast are your breast. And even if they talk openly about it, it's not kind of a, oh, ooh, breast. But for some reason, the penile enlargement and this type of topic is kind of taboo. And we're trying to really figure out the best way of tearing down that taboo because I feel in 2024, we shouldn't be talking about these things being, oh my God, you're disgusting. I don't, oh, this is something that bothers people, whether it's their loss of hair that bothers them, they want more hair, whether it's their fine line or wrinkle, whether they have small breasts or small butt. So I feel like this should be a topic that men should be comfortable talking about. And we're going to really try at NDA and me personally to kind of get it out there so people are comfortable talking about this. And I appreciate you taking your time and tonight and spreading the word. And again, everyone's got my phone number and my email. Feel free to text, email me questions. Always happy to jump on a call to talk about what we're doing. And I hope everyone has a great night and go Eagles.